Hi, I'm Dr. Sulaiman Ladhani. I'm a consulting pulmonologist practicing at Wockhardt, Mumbai Central, and I'm in this field since the last 20 years. See, basically, pneumonia is infection of the lungs where the lungs there is inflammation and superadded infection by either a bacteria or a fungus or a viral. And if not treated in time, it can have serious consequences. इसके complications भी हो सकते हैं, जैसे कि वो पूरे body में फैल सकता है, respiratory failure हो सकता है, and if not treated in time, it can also lead to death. See, basically, when a person is exposed to either a bacteria or fungi, and if their immunity is low, or if they are young children or old people, due to any reason, if there is an exposure to these organisms, they go into the air passage, then into the lungs, and there they cause inflammation and swelling, which leads to symptoms of cough, breathlessness, high grade fever, and they sometimes may lead to a cavity also in the lungs if it is very severe. And once that happens, the patient starts getting these symptoms as I explained, like fever, breathlessness, and headache, body ache. And if not treated in time, then the patient may have to be admitted and treated with appropriate antibiotics and other supportive care. And if treated in time, the patient can recover fully. Basically, double pneumonia is a layman's language. Here, it is a severe form of pneumonia where normally both the lungs are affected, and the infection or the inflammation of the pneumonia is basically seen in both the lungs, and this is more severe form of pneumonia, and sometimes this require hospitalization and treatment with appropriate IV antibiotics or the underlying cause for getting it under control. Pneumonia is a term that we use for atypical pneumonia. Early presenting signs is very similar to flu and our day-to-day common cold that we get. तो patient को initially थोड़ा सर्दी जुकाम जैसा high grade fever, body ache, and maybe cough is seen. And if it progresses further, then patient starts feeling breathless and fatigued. He cannot walk, and these are signs or warning signals that there is something wrong, and we should take immediate action and try and visit your nearest doctor or hospital at the earliest, especially if you are immunocompromised or a young child or a senior citizen more than 65 years of age.
Cases in low resource setting.
See, basically, first of all, we need to ensure that there is access to basic health care for the child. Ensure that they are living in houses where there are good ventilation, good hygiene practices, good nutrition support, and if the child is small, early breastfeeding is very, very necessary, and vaccination to prevent them against pneumonia. So these are basic facilities that a child should get in low resource settings to ensure that the prevalence of pneumonia in these settings is low.
To spread their lungs and overall respiratory health during recovery.
See, basically, adequate rest is very, very important, because once the patient recovers from an acute infection, their body is very weak, so they need proper rest and proper supportive care. So adequate rest, good hydration, giving them very good nutrition, especially high protein diet, and ensure that if there are underlying comorbidities like blood pressure, diabetes, or any underlying heart issues, that should be properly controlled so that the body gets a chance to recover. Adequate vitamins and nutritional support will also help in these cases.
There are common myths that cold weather alone can cause pneumonia. Is there any truth to these, or are there other more significant factors that increase the risk?
See, basically, cold per se doesn't cause pneumonia, but the cold weather facilitates an environment where a patient can acquire pneumonia. Basically, temperatures are low, there is a lot of smog, presence of bacteria and viral in the air during this season makes a person susceptible to get pneumonia, especially if you are a young child or a senior citizen more than 65 years or immunocompromised with any chronic illnesses, then this time it becomes very susceptible atmosphere for these people to catch this infection.
Can be effectively treated with rest alone, while other things antibiotics are always needed. Could you explain the reality of treating different types of pneumonia and when antibiotics are necessary?
See, basically pneumonia can be of various types. As we discussed before, either it can be bacterial, viral, or it can be fungal also. So if it is a mild pneumonia and if it is viral, basically adequate rest and supportive care can help. But in case of bacterial pneumonias, appropriate antibiotics are necessary for killing the organisms and treating the infection. Same goes for the fungal pneumonias, especially in the immunocompromised patients. So if a patient having bacterial pneumonia, which is very common, they will need appropriate oral antibiotics if they seek treatment early. But if there are complications, then they may require hospitalization where they are provided with IV antibiotics and other supportive care to treat the underlying infection.
Some early signs of pneumonia that people should look out for, especially those who may be at higher risk.
See, basically pneumonia is commonly seen either in young children or senior citizens more than 65 years of age, or people who are immunocompromised. But they can also happen in healthy individuals. The early signs that you first see basically depends upon the age and the underlying comorbidities. But normally you will see fever, which may be of high grade, cough, and flu-like symptoms. As it progresses, patient may start getting breathless and may get severe body ache, may not be able to walk. But especially in senior citizens more than 65 years of age, the pneumonia may present in a different way. So they may basically have confusion, diarrhea, stomach discomfort. Fever may not be a prominent sign. So it's very important to keep this in mind, especially in senior citizens where the presentation may not be a typical pneumonia presentation of fever, cough and breathlessness. They may have other symptoms like confusion, stomach ache, loose motions and sudden onset breathlessness. So these are the common presentations, and once you suspect this, immediate medical attention needs to be taken so that proper adequate treatment can be provided.